One of the healthiest people I know. She's a registered dietitian here in Madison, and we've had her on the show many times in the past sharing nutrition advice. So she's one of the last people you think would get COVID, but she did. She joins us this morning to tell us a little bit about what that was like. Good morning, Emmy.
Good morning.
Thanks for coming on. I wanted just to start by finding out what symptoms you had that caused you initially to get tested.
Well, it's actually really funny. My symptoms didn't prompt me to get tested. We thought my fiance had interacted with someone who we thought had been exposed, and that actually wasn't the case. But that did prompt me to get tested. I had a really, really mild sore throat when I got tested, but that's not what prompted me to get the test.
And so after you got the test, did you get more symptoms? Did those symptoms worsen?
Yes. So I got my positive results a couple days after the test, and pretty much on that day and after, my sore throat worsened a little bit. I developed a mild, maybe moderate dry cough, some body aches, really small shortness of breath. My fatigue was very bad, but I never developed a fever. I did have some GI issues. All things that I thought I could explain away for a million different reasons, you know, seasonal allergies, a seasonal cold, that kind of thing. And none of the symptoms would have ever prompted me to get a test in my mind, just because they weren't ever, aside from this fatigue, very severe.
How long did these symptoms last? I know the average battle for healthy people like yourself is around 2 weeks. Was that a time frame that is familiar to you?
Yes, yeah. I would say it was about 2 weeks until I felt fully healthy. I was definitely in bed, unable to work for a full week. And then things started to kind of dissipate for the 7 days after that.
So what would you say to people who are watching this, who like you might not get tested, maybe they weren't exposed to anyone else with the virus? What would you say to someone who might just not want to get tested right now? The lines are long.
Yeah, well, I would say this. If you have any of the symptoms listed, and I mean any of them, not relying on the fact that you don't have a fever, I would recommend to get tested, especially if you can explain any away to, you know, being tired, having allergies, having an upset stomach. It's just worth it to go get tested. Although my symptoms were never severe enough to seek medical care or hospitalization, the fact that there were several days that I didn't know I was positive, that could have put someone else at risk. So it's really important that you get tested so that we're not continuing to spread this virus.
Do you have any idea where you could have gotten the virus?
That's something we laugh about, because I am probably the most, we'll say, recluse person during this whole time. I've been inside. I was rarely going out. I was really just starting to go out the week prior, taking bike rides. So that's what public health kind of determined may have been where I contracted it, leaving my apartment building. And although I always wear a mask and always use hand sanitizer, there could have been a time where I wasn't paying attention and, you know, touched my glasses, and there you go. So it's unknown at this point, but even the most careful people, you know, can get it.
It really can happen to anyone. And do you have any lingering side effects now? Because I know that some people, even if they've had just kind of lingering aches and pains, or are you good?
I still have a sore throat. It's really mild, but it did prompt me to get tested again, just to be sure, and I'm negative. So those lingering side effects do still last.
It's certainly nothing to mess around with.
Exactly, and I will have to say I'm extremely lucky that my case wasn't severe, because we do hear severe cases for young, healthy people. So I'm just happy that mine wasn't, and we know that I didn't pass it to anyone else. So those are things that I'm thankful for.
Thank you so much for sharing your story with us. And hopefully next time you come on the program, we're talking about something a little more fun,
right,
like food.
I hope so too.
Thanks, Emmy. Have a great day.
Thank you. Yeah, you too.
And you can be sure to connect with Emmy on her Instagram page, realgood_nutrition, and on her website, therealgoodnutrition.com. She shares some great, really healthy and delicious recipes. So we're going to give you a few reasons to